So I'm going to tell you a little bit more about my wife. Her name is Kathy. She was, maybe 2 years ago, her blood sugar was normal. We'd go in once a year, we'd get our lab work done, and it was normal. And so back in 2018, she came back home and she said her hemoglobin A1C was at 12.48. And I said, uh-oh, that's a really bad number. And normal would be around 5.5, 5.6, 5.7, and lower. That's what you're looking for. So her doctor recommended that she start taking metformin and a few other diabetic medications, and she came and asked me, and I said, Kathy, once you get on that, it never ends and it just cuts your life short. I said, if I was you, I would work with diet. And so we did. We worked hard with diet, and about this same time I learned about the regenerative solutions that we've come to be called. And so with a strict diet, which basically included no sugar, no bread, no potatoes, nothing that breaks down into sugar in her diet, we were able to get her blood sugar down to about 7.48, which was a huge difference. And that was without taking any of the pharmaceutical drugs that were recommended. Now, we talked to her doctor about this, and her doctor said he had never seen anybody control that kind of A1C with diet, but that he would be okay if she tried it. So we did try it. We brought it down. He was pretty excited about that. And then we went to Colombia, South America. She had the anti-aging protocol, which is an IV. She had about 110 million cells put into her system, and they just start repairing things. Of course, the pancreas, the liver have to be fixed with diabetes, but we got back and her next A1C was 5.48, I believe, and her blood sugar, pre anything, her blood sugar was in the 300 to 600 level, her fasting blood sugar. And this all happened within the time of 1 year. 1 year she's not, I can explain why that happens, but in 1 year she went from being normal to diabetic, and then a year later she's not diabetic anymore. The medical tourism, the trip that we took out there, we did the IV with her. When we got back, we would check her blood sugar almost every day, and it just started dropping. And it got down to where her fasting blood sugar, which we would always take before breakfast right after she woke up, was in the 80s. And this would be considered by most places impossible without the use of drugs or medication. And we did this with her changing our diet and with regenerative medicine. So I'd recommend that if you have diabetes, type 2 is almost 100% get fixed. Type 1, about 60% of them show great improvement. But these are the types of things that you can do with regenerative medicine. It just boggles your mind what can be done. And it's an exciting field. It's popping up all over the world, all over the United States until this COVID-19 thing. But anyway, the idea here is that once this is over, if you're interested, we can take you out to Colombia for serious problems, but I need to know if you have them or not. So give me a call, let me know, we'll talk, and I'll tell you what can be done for you, either locally or internationally. Thank you.